So this underlying conflict and maybe some anxiety, maybe some depression. So this has to be corrected through cognitive behavior therapy only, not giving some aversive painful stimulus, etc. Other than that, there are certain behavior therapies like exposure, response, prevention, which is indicated for OCD, right? And systematic desensitizations. Both of these are similar and both are terms sometimes used interchangeably, sometimes also, which is preferred for phobias. But it can be used interchangeably. Okay, so these are certain named therapies which you have to know in order to have a quick recap. Certain questions are asked. So these days, every alternate year, there is one question from psychotherapy. Okay. Right. Now, coming to alcohol. Alcohol, you have to read everything. There is, if they are asking one question from psychiatry, that question will be from substance use disorders. And from substance use disorders, alcohol is the most important thing. So alcohol, anything from blood alcohol concentration, withdrawal symptoms, Wernicke's, Korsakoff, withdrawal seizures, delirium, treatment, even motivational stages was a question in the previous INI-CET exams. So, generally in alcohol withdrawal period, you have symptoms of tremors, tremulousness in the initial 6 to 8 hours. Then you have alcoholic hallucinosis. Then you have alcohol withdrawal seizures, which is called as rum fits, which is a generalized tonic-clonic type of seizures. Then you have alcohol withdrawal delirium, right, which is a confused state, which is called as delirium tremens. For all of this, the treatment is long-acting benzodiazepines. Generally, benzodiazepines are the treatment for alcohol withdrawal. Even if it's a seizure, you need not give any other anti-epileptic. You need not go for any other medications. Benzodiazepine substitution usually will work. Anti-craving agents, acamprosate, naltrexone, these two are very common. Other than that, baclofen and disulfiram is a deterrent agent which can be used. Motivational stages we usually discuss in class, right? There is pre-contemplation, where I am not even thinking about quitting. Then there is contemplation, where I am thinking about quitting alcohol or any other, any other substance of abuse or any other habit which is a maladaptive habit. Contemplation, pre-contemplation, contemplation, then preparation, where I'm actually taking steps. Let's say I'm visiting a doctor, or thinking about quitting, or I've actually, like, let's say I've cleared out all the alcohol bottles in the home. So I'm preparing to quit. Preparation. Action, I've actually quit alcohol. And then either you go for maintenance and the maintenance continues until there is a relapse. And after relapse, you go into the same cycle of pre-contemplation, contemplation. So these are the stages of motivation, again asked during an INI-CET in 2024. Okay. Right. And then again, very, very easy, very, very common. Everybody knows, but they still ask these questions repeatedly. Wernicke's encephalopathy, which is indicated by the symptoms of Goa, global confusion of thalmoplegia and ataxia. So this is about Wernicke's encephalopathy. What is the important thing that you should know? You should give thiamine before giving any IV fluid, especially glucose containing IV fluids, because of the because of the risk of precipitating Wernicke's encephalopathy. When it left untreated, it was for Korsakoff psychosis. It might have psychotic symptoms, plus it has confabulation, right? And because of why confabulation? Because of anterograde amnesia. Okay, so these are some of the very important topics from alcohol, which is frequently asked. Okay, other drugs, if you see opioids have been asked. In opioids, you have to know about opioid intoxication, which is a very, very life-threatening emergency where there is pinpoint pupils, respiratory, depression, coma, and the treatment is naloxone, which is an opioid antagonist, and it is a short-acting antagonist. Okay. In cannabis, you should know that cannabis has multiple names like bhang, weed, hashish, charas, etc. And it does not have any major physiological withdrawal symptoms, right? It has a psychological dependence and the feel good sensation, and it causes sometimes anxiety-like symptoms called as a bad trip. Okay. Am I making sense? Am I going too fast? Is it okay? I'd like to see some responses. Right. Okay. Fine. Thank you. Thank you. Right. So other than that, other substances, nicotine treatment. Nicotine treatment, what are the important drugs you should know? Nicotine, there are substitution therapy, nicotine patches, lozenges, nicotine gums, nicotine nasal spray, oral inhaler. These five are nicotine replacement therapies. And the medication, especially in nicotine, is varenicline and bupropion, so which has been again frequently asked. And cocaine, tactile hallucinations, like one of the most repeated questions. Yes, one of the most repeated questions, cocaine bugs, tactile hallucination, cocaine bugs, tactile hallucination, right? Madman syndrome, formication. All of these terms have been asked interchangeably in various exams. So it's one of the repeatedly asked questions. Okay, right. Then opioid intoxication is important. Again, opioid withdrawal is also important. So there you have leakages from every orifice and pupillary dilation and piloerection, etc. And the medication in the opioid substitution therapy, buprenorphine and methadone. Commonly used medication, opioid substitution therapy. Again, here also anti-craving agent, you can use naltrexone. Okay, and generally you go through the epidemiology, most common in males or females, which common age group, what is the percentage of incidence in almost all the chapters. We have like 20 chapters, which includes, let's say, around 20 let's say around 18 to 16 to 18 disorders, and each of this we have discussed epidemiology. So just go through these epidemiology. Epidemiological questions are unpredictable. Sometimes they are asking it. Okay. And sexual disorders, again, there has been question on premature ejaculation. In premature ejaculation, what was the question? Question was, which of this can be used as a treatment for premature ejaculation? And there was this stop start technique. Right? Medication you can use depoxetin or any SSRI. For erectile dysfunction, psychogenic erectile dysfunction, you can use sildenafil, tadalafil, vardenafil, etc. And paraphilias, again, very, very frequently asked question in the form of match the following was generally individual paraphilias. So, in the recent years, in the past, in the couple of years, transvestic fetishism was asked. Transvestic fetishism is where a person gets sexually aroused in dressing as the opposite sex. Right, so transgender is different. Transgender is gender dysphoria where the person wants to live as another person. They feel like a woman trapped in a man's body or a man trapped in a woman's body. They just want to change their external appearance because their psychological inclination is towards that particular gender. Whereas transvestism or transvestic fetishism is a paraphilia where there is a sexual fantasy, sexual arousal on dressing as the opposite gender. Right, like that there are exhibitionism where there is exposure of their private parts or genitals to unsuspecting individuals, touching or other molesting in the form of frotteurism, fetishism, getting aroused by non-sexual parts of the body or non-objects which are of not sexual in nature, and pedophilia where they are having fantasies or sexual fantasies with children, etc. So paraphilias, again, it's an integrated question between forensic and psychiatry, but in psychiatric questions, they ask it frequently. Okay. Child psychiatry, again, what is autism? Autism is a social developmental problem where there is deficits in social communication and repetitive rigid patterns of behavior. Language impairment may or may not be present, but these two are usually present. Okay, ADHD is a neurodevelopmental disorder. Again, autism is also a neurodevelopmental disorder. ADHD is attention deficit hyperactive disorder. It has inattention subtype and hyperactive or impulsive subtype, or a combination of both. Rett syndrome. Rett syndrome is an autism, a subtype of autism seen in female children where there is normal development till 6 months of age and there is regression of milestones. Why is Rett syndrome important? Because there is this new drug trofinetide which is approved for Rett syndrome and it was asked in a question. ADHD medication stimulants, you know, methylphenidate, right, and amphetamines as stimulant, right, non-stimulant medication, tamoxifen and reboxetine, which is an norepinephrine reuptake inhibitor, okay, and also you can use alpha-2 agonist, guanidine, clonidine, guanfacine. Okay, right. Sleep disorders generally, even EEG, image-based question was asked 1 year. Generally, let's say till 6 years of age, stimulants are not preferred because stimulants cause growth retardation in children. So after 6 years of age, if you are preferring stimulants, you can prefer. But it is not a hard and fast rule, but you can remember 6 years. Okay. Then EEG, OG, EMG questions. Image-based question from EEG. I've given the, I'll show you the image where a sleep spindle and K complex was asked, and EEG in each phase, what are the changes that is usually asked. Other than that, thought disorders, names, which we usually discuss. What is panic disorder? There was a question. Phobia names can be questions. Catatonia named symptoms, potential question, not yet asked. It can be image-based question. Reboxetine below atomoxetine is REBO. Reboxetine was a question. Okay, right. For catatonia, the treatment is IV lorazepam or ECT, which has better treatment response, good prognosis, and other ECT indications, severe suicidal ideation, resistant schizophrenia, resistant depression, catatonia, and postpartum psychosis. Right? Okay. So let us just discuss other important aspects. So this was a controversial question. So I've just given you the textbook itself. So lithium in pregnancy, lithium does cross across the placenta. It equilibrates. Okay. So you generally try to avoid lithium if you're going to start it for the first time in that woman who's planning for pregnancy. But if she is like a bipolar affective disorder patient and is on medication since her young adult, since her teenage, and she's maintaining well on lithium, whenever lithium derangements occur, there is a precipitation of symptoms. In that case, you cannot suddenly stop lithium because pregnancy is a high risk period for an episode of depression or mania, that is bipolar, right? So if that is the best drug, right, you should not withhold or stop it abruptly just because they are pregnant. Okay, even though Epstein's anomaly is a cardiac anomaly, but it has a very small effect as per recent studies. So in the first trimester, the risk is Epstein's anomaly. Second trimester, there is no much problem. Third trimester, there is change in pharmacokinetics. So in the initial part of third trimester, you have to increase the dose of lithium to maintain it in the initial part as the total body water increases. Whereas when it is immediately after delivery, it goes to pre-pregnancy level. So you have to reduce lithium and you have to stop during active labor. Okay, so basically the best answer would be monitoring, lithium monitoring and adjusting the dosage. But if it is generally asked in third trimester, in the initial part of third trimester, you have to increase the dosage of lithium. Okay, this was a controversial question, so I've just discussed the points here. Okay, now some questions. Okay, a patient with depression symptoms was prescribed amitriptyline. Amitriptyline is a tricyclic antidepressant. Okay, she was found unresponsive. So the following is not due to 2CA toxicity. So amitriptyline is a tricyclic antidepressant, and in the initial stages of recovery, there is an increased risk of suicide, which is called as paradoxical suicide. Correct? Right. So what happens if a person given amitriptyline takes like 10 tablets, 20 tablets of amitriptyline, there is TCA toxicity. In TCA toxicity, there is coma, confusion, coma, and cardiotoxicity, cardiotoxic effects, and anticholinergic effects. So if you look at it, confusion is there, arrhythmia is there, anticholinergic effects. So pupillary dilation should be there. It is not hypothermia, but hyperthermia is usually present. Hence, the question is not, so the answer is B. Good. Sandhya and Dharani, good. Thank you. Right? So here, if the cardiotoxic effect QRS complex goes more than 100 milliseconds, then you have to start sodium bicarbonate. Okay, so it's a treatment of choice. Mood stabilizers that causes hepatitis and hyperammonemia. So I've told you mood stabilizers, usually they're asking as questions. Hepatitis, hyperammonemia, everything that is H, hair fall, hirsutism, hepatitis, hyperammonemia. So a lot of this H side effects are commonly seen with sodium valproate. Lamotrigine is notorious for causing Stevens-Johnson syndrome, skin rashes resulting in Stevens-Johnson syndrome. Carbamazepine is notorious for causing, let's say, attack. It's an enzyme. It causes again rashes, aplastic anemia, right? ataxia, etc. Right. Now, this is a question which I am expecting have they not asked, because in mood stabilizers they have asked lithium, they have asked sodium valproate, they have asked carbamazepine, they have asked oxcarbazepine. So one thing which is left over is lamotrigine, which they have yet to ask. So I am expecting this question on drug interaction between lamotrigine. Okay. So diagnosis of bipolar depression. Okay, 50 milligram of lamotrigine is started, but they are now adding sodium valproate. What is sodium valproate? Sodium valproate is an enzyme inhibitor. When you give something with an enzyme inhibitor, you have to reduce the dose. So here, no same dose cannot be maintained, it can be given together, right? So it should be halved. So when will it be doubled? When you give it along with carbamazepine, which is an enzyme inducer. So this question is kind of an expected question from my side. Okay. Okay. Which of the following are included in Korsakoff psychosis? So this was a previously asked question last year. Korsakoff psychosis, it is a psychosis, so psychosis should be there. It causes retrograde, anterograde amnesia, it causes confabulation. Ophthalmoplegia is a symptom of Wernicke's encephalopathy. Hence the answer is 2, 3 and 4. Right? Okay. All of the following side effects are seen with carbamazepine than oxcarbazepine. So this was the thing I told, carbamazepine, oxcarbazepine. The only difference is hyponatremia is very common in oxcarbazepine. The remaining are very common in carbamazepine. So carbamazepine was a drug which was mainly synthesized to counteract the side effects of carbamazepine, but it ended up causing a lot of hyponatremia. Again, in autism spectrum disorder, all of the following clinical features are seen except, so all except question. Abnormal communication is usually seen, abnormal socialization is usually seen, restricted behavior and interest is usually seen. So here, language is not mentioned, communication is mentioned, non-verbal communication is affected, so normal communication is present. Abnormal cognition is about intelligence. Intelligence need not be always affected in autism. So intelligence is not, there are around 30% of comorbid mental retardation with autism, but it is not generally associated. So this is the better answer. A patient has repetitive thoughts about contamination and a compulsive hand washing. So what is this a disorder of? So contamination, what if this is, this is a repetitive thought. What if this is unclean? What if there are germs? That kind of repetitive thought and compulsive behavior. So this is a disorder of OCD, obsessive compulsive disorder. Obsession is a disorder of thought possession. So it's almost like your own thoughts are possessing it. So it is a thought disorder. So thought disorders generally, let's have a quick recap. Disorders of form, stream, content, and possession. In possession, you have obsession and thought alienation. Thought alienation, you feel like somebody else is controlling your own thoughts. So there is thought insertion, thought withdrawal, and thought broadcasting. Disorder of thought content, where the content is actually false. There is delusion, multiple types of delusion. Disorders of thought form, there is loosening of association. It usually gets overridden, right? There is loosening of association, there is derailment, right? There is neologism, right? There is thought block, okay? Again, flight of ideas. Tangentiality here. Thought retardation. Perseveration, etc. So there might be overlap in form and stream from multiple sources of textbooks, but these are the general idea, right? So here the question is about obsession. Okay, it's a disorder of thought. Okay, so this is in the stage 2, N2 of non-REM sleep, stage 2 of non-rapid eye movement sleep. This kind of thing is the K complex, and this is the sleep spindle. So it's a burst of things. This is the spindle, and K complex is like a ECG complex. So this was a picture-based, image-based question which was asked. So they gave a picture and they highlighted this part and asked which stage of sleep this was. Right. Other possible image-based questions, if they, because they are hell-bent on asking image-based questions in every subject. In psychiatry, there is not much images, so they have to go through such images. So this is a electroconvulsive therapy machine, ECT machine. We have to give now modified electroconvulsive therapy, because unmodified electroconvulsive therapy is actually banned according to the Mental Health Care Act of 2017. So you give it along with anesthesia, right? So this is a bipolar ECT. Other than that, there is also unipolar ECT. In ECT, your brain-derived neurotrophic growth factor increases. Okay. Right. So this is a repetitive transcranial magnetic stimulation device. This is RTMS. You have a figure of 8 coil, right? The machine is positioned at targeting a particular brain area, and it is set, let's say, a depression protocol, OCD protocol. This is used for resistant depression, resistant OCD, etc. It's now researched for multiple conditions, but usually for resistant depression. So this is an image of oculogyric crisis, which is a type of acute dystonia. The eyeballs have moved up and stayed there. It is a painful condition. So patient will come in agony, right? It's oculogyric crisis, acute dystonia, which is a side effect of mostly typical antipsychotics, dopamine antagonist side effect. Okay. Now this again is a possible question. This is Russell sign seen in bulimia nervosa. So Russell sign, bulimia nervosa is a eating disorder where the patient induces a lot of vomiting. So when the patient induces vomiting, they use their fingers to stimulate the posterior pharyngeal wall and they induce vomiting. When they do this multiple times, their knuckles get eroded, and that is called as the Russell sign. Right? So this is an image of Maslow's hierarchy of needs, right, given by a person called as Abraham Maslow. So a person, a human being's needs are to be addressed in this hierarchy. First, your physiological needs, Then your safety. So without food and water, you cannot think of anything. After that, you think of your safety. After your safety, you will think of a family, social connection, meaningful connections. Then you think of your own self-esteem, what you want to become, what all you should do, what all you should not do. And at a particular level, people who are extremely philosophical, etc., have the stage of self-actualization. So this was given by Abraham Maslow. It's a psychological theory. Again, can be an image-based question, so I'm just giving you here. Not yet asked. Again, this is a possible image-based question. This is sanguine form board test. So this is SFBT, sanguine form board test. So these are like blocks. Okay, it's like a toy. Okay, but these blocks are kept outside, and the child is asked to put it correctly. Right, depending upon how long, how many minutes the child is taking. Usually 3 trials will be given. After the second, third trial, the child should complete it faster, and the average will be taken, and there is a list where this corresponds to the particular mental age. So this is used for assessing IQ in pre-verbal children. So generally other IQ tests, let's say Binet Combat test or Mallin's intelligence assessment scale, there are multiple tests, Bechdeli's intelligence scale. So in all of these tests, the questions are verbal. So this is a performance-based IQ assessment test in pre-verbal children can be properly used. Okay, so IQ is mental age by chronological age into 100. So here we will get the mental age of the child. Again, if they want to go a little deeper and ask an image-based question, such questions can be asked. Right? Now let's discuss the recent INI-CET questions, right? So Lord Hanuman is celibate, I am celibate, so I am Lord Hanuman. So this is psychopathology described in case of schizophrenia. Basically, you do ruling out.